Okay, screen up. Do we see the slide deck?
Looks great.
Terrific. Okay, thanks everybody for taking some time this afternoon to join us. It is open enrollment season and everybody's thinking about their health care. And I'd just like to thank Sarah too for having us. We've been partnered up with UASA since 2019. So if my math is correct, I think we're entering our 6th year with the association in February. So it's been a real successful program. Kind of the sweet spot is really for the small business or the sole proprietor. I know many of the members there, that's the category they fit into, where there aren't a lot of options for traditional health insurance, either from the state exchange or you might not qualify for a group plan or something like that. So we've done a lot of business with UASA members, and we've been delighted with the relationship. So if you're unfamiliar with the program and this is your first kind of look at it, I'm going to step through the slide deck today and give you a pretty in-depth view of the program. It'll help you hopefully decide if you have interest in joining, and we'll talk about a few of the considerations too when you're making a decision. So with that, and also, I guess, Sarah, you're gonna grab questions in the chat box, or I generally will hold them till the end, but I encourage folks to put them in there, just so we have a record of them and make sure we can get to as many of the questions as possible.
Yep, and if they want to raise their hand, they can do that as well, and then we'll answer those questions at the end.
Perfect. Okay, terrific. All right, so let me just jump into it. So what is the SALA healthcare program? Well, SALA, first of all, is a membership organization like UASA, and United Services is a member of SALA. And what we do is we provide services to others associations and develop membership programs like the healthcare program. And when we launched SALA, this was the #1 asked for benefit program from our members. So we launched the program in 2018. And like I said, we've been with UASA since February of 2019. So why did we do it? That's kind of the main reason. What were our objectives? We wanted to simplify a complex business health insurance. We wanted to provide an affordable solution with flexibility that covered both preventive care and catastrophic and major illness. And we decided that kind of our benchmark for offering it would be there had to be tangible savings to the member who participates. We looked at traditional insurance products for a while, and they only really were going to generate on average 6 to 7% savings. So we didn't really think that was worth it. This program, the way it's structured, on average is saving between 50 and 60% off your monthly cost, depending on where you are in the country, and whether or not you have eligibility for a COVID subsidy on the state exchange or something like that. But just generally speaking, when you compare to straight up state exchange rates or a traditional group plan, you can expect to see somewhere in the neighborhood of 50% cost savings. And then the last bullet there we're very happy with. We periodically go out and survey members to find out if the program is working for them. And as you can imagine, we were pretty thrilled to see a 91% response rate saying they were either very or extremely satisfied with the program. So how does it work? It is an alternative approach to traditional health insurance, and it's built on 2 primary components that work for separate parts of your health care, and I'll talk about that in a moment, but together they provide a comprehensive solution. The first are preventive care plans, and that's through an organization called eBenefits Administrators. And that is paired with a medical cost-sharing plan from Sedera. And then finally, there is a add-on dental plan that leverages the Aetna Dental Providers Network, and I'll touch on that a little bit. So to understand the program, it's best to think about your healthcare in 3 silos. So on the right side, you have preventive care, and that's your 80 federally mandated preventive services through the Affordable Care Act. And then in the middle, you've got kind of your day-to-day routine stuff, cold, sinus infections, maybe a twisted ankle, something like that. And then on the left side, you've got the big stuff. So this is your catastrophic things, anything involving the hospital, surgery, cancer, major accident, illness type things. So E-benefits, both plans take care of your preventive care. The Summit plan, which we'll discuss in a moment, will cover your small, medium costs in the middle, as well as telehealth. And then your big stuff is all handled by the Sedera part of the program. So let's talk about Sedera first. Sometimes people aren't familiar with medical cost sharing, how that works. So let's just jump into that. Really, the motivator behind medical cost sharing from Sedera's perspective is illustrated by this slide, where you have workers' earnings aren't keeping up with premiums in the health insurance industry, and deductibles are skyrocketing. Sedera was founded by a company called the Caris Group, and the Caris Group is a bill negotiating firm. And in the 80s, when medical cost sharing got started, largely through healthcare ministries, which you may have heard of, religious groups that come together to share health expenses, the Caris Group supported those organizations, but they saw an opportunity in the market to create a health share platform that was not based on a religious mandate. So that's why they created Sedera. So a couple of key points on how medical cost sharing works. It's primarily a free market type of approach. So there's no medical networks that are used. It's structured on a cash pay system. So basically, you go in, request to be invoiced for services. Pretty much, if you identify yourself as self-pay or cash pay, you're going to get a reduced medical bill anyway, oftentimes 50% or greater. And I have a personal story about that I'll share. My daughter had a genetic issue related to prescription drugs, and her doctor wanted her to go through some DNA testing to find out what prescriptions or what groups of medications she had that predisposition towards. So as parents, we said, yeah, that makes sense. So we had the test done. Initially went through the e-benefits side of the program, and I'll explain why this happened, but it was rejected because it's not preventive care. It was a diagnostic type service. So that immediately shifts you over to the Sedera part. Well, the bill was $5,650 for a set of tests on our daughter, which made my eyes pop out of my head. So I called up Sedera and said, hey, I've got this bill. How's this going to work? How do I submit it? Long story short, the cash price for that test was $330. So they were billing $5,650 to insurance. The self-pay cash pay price was $330. So members will see those types of savings whenever they identify themselves as a self-pay or cash pay patient. So that's really what underpins the whole approach of medical cost sharing. It's the idea of reducing medical cost overall and the impact it has on communities. And I'll go ahead and jump in now on the mechanics of it and how it works. So there's not insurance. Like I said, it's medical cost sharing, and it operates a little differently, and they use different terminology, which I'll get into. So on this slide, there's a couple of key points. As I mentioned, at 6 o'clock, there's no networks. So there's no copays and no networks you have to operate within. You can use any doctor of your choice. At 12 o'clock, a key takeaway term, every member is a cash pay patient. So you're not presenting yourself as having insurance. You're saying, I'm a self-pay patient, please invoice me. And then finally, at 10:30, you'll see sharing on a per need basis. Need is capitalized because that's the key construct of how medical cost sharing works. And what does a need mean? A need is one or more shareable medical expenses caused by a single accident or illness. So let's take the icons across the top. Let's say you have a broken leg. That broken leg would constitute a need. It's a medical incident. Any treatment or services provided to treat that condition would be bundled into that need. So an ambulance ride, hospital visit, labs and imaging, whatever services are needed, and then perhaps physical therapy on the back end. All those bills get submitted under that need. So another key concept or takeaway is the idea of an IUA, initial unshareable amount. It's basically your deductible. It's what you agreed to pay first of the bills that come in for your need. And there are 5 options to members when they enroll. There's a $500 option, $1,000, $1,500, $2,500, and $5,000. So In this scenario, if you had $1,000 IUA, you would pay the first $1,000 of the bills related to your broken leg. The rest would be shared with the community. So it brings a great deal of certainty around out-of-pocket expense, which is enhanced by the last area down there in the bottom right. Sedera only asks members to pay the first 3 IUAs for their household in any membership year. So your max out-of-pocket for any year is going to be 3 times your IUA. So if you had to use Sedera 4 or 5 or 6 times during the year, hopefully that would never happen, obviously, but you would only pay the first 3 IUAs. So if you had $1,000 IUA selection, your max out of pocket per membership year would be $3,000. So again, it's a way of really bringing a lot of certainty around your potential out of pocket expenses with the program. So let's give a real life example. This is actually the CEO of Sedera, and his child had a condition with persistent ear infections, and they went through a whole battery of treatments on it, including antibiotics, and eventually ended up, long story short, inserting the tubes into the child's ears. So let's see how that broke down. This is before he joined Sedera, with a comparison of how Sedera would handle it, which illustrates the IUA approach. So in health insurance on the left, with a $5,000 deductible, for example, you have your copay and your prescriptions and all that, all the way down to the surgery, which ran $2,100 for a max of $2,525 for the entire need for this child. If they'd been a Sedera member, and in this example, they have a $500 IUA, they would pay the first $500 of the bills. There would be no copays or network restrictions, as I mentioned. And any bill after the $500 has been met by the member would be shared with the community. So what that means is Sedera would be cutting checks back to you, and you would pay the provider's invoices with the money that's coming from Sedera. So it's not a situation where you would pay all the bills up front. Sedera only recommends that you pay the amount of your IUA, and then the rest of the bills are submitted to Sedera for sharing. Well, kind of the let me see, I'm going the wrong way here. The way this story ended up was the tubes fell out of the child's ear in the following year. And because traditional insurance has a deductible reset, they had to go back in for another surgery. They didn't meet their $5,000 deductible. And basically it turned out to be a $4,900, $4,800 condition for the child. With Sedera, your IUA will only reset after you've been free of symptoms and treatment for 12 consecutive months. So treatment can span calendar years, and you're not going to have to go back in and pay your IUA again until you've gone a year without treatment or symptoms. So in this case, the second surgical procedure would have been covered entirely under the first need and the $500 IUA. So hopefully that makes sense, and we can dig into more details on that with the Q&A at the end. So sometimes people say, wow, sounds too good to be true. What's the catch? The catch is there are limitations on pre-existing conditions. So we spend a lot of time with members going over what this means. If any of you are interested in joining the program and you have concerns about your pre-existing conditions, email us. We can get on the phone or just handle it by email and assess what the impact is on you. For a pre-existing condition defined as a symptom or treatment in the 36 months prior to joining. So you have that broken leg last year, it's a pre-existing condition. If you had it 5 years ago, it is not a pre-existing condition, and you wouldn't be disclosing it. So for that condition only, there's no sharing in year 1. There's a $25,000 cap in year 2. There's a $50,000 cap in year 3, and then fully shareable beyond. So it doesn't mean you can't join. It just means that you're going to be limited on sharing of costs related to that pre-existing condition. So example, my partner Kevin has rheumatoid arthritis. He's had it for years. He has an annual visit with his rheumatologist, and he has medications he's on. And he felt that there was a very low likelihood of any complications coming up with it. So he felt he could get through this phase-in period on the pre-existing condition. He's now in year 4 with it. and everything is fully eligible. And the point is that if you have a pre-existing condition that is well maintained, that it has a low likelihood of incurring any costs related to it, it's probably fine for you to join the program. But we do want everybody to be aware of this, and we are happy to talk to you one-on-one about these limitations, because we don't want anyone enrolling and putting themselves in financial jeopardy by doing so. So hopefully that makes sense. So medications. The way medications are handled in the program, divided into two categories: curative medications and maintenance medications. So curative medications are typically associated with a need under SADERA. So it might be pain meds or antibiotics or something related to that need. Maintenance medications are stuff that are ongoing, like cholesterol meds or blood pressure meds, things like that. They're handled on the e-benefits side of the program. So curative meds covered up to 120 days. If it becomes a maintenance medication as a result of your need, it would then shift over to the e-benefit side after the 120 days. But up to 120 days, any prescribed medications would be bundled into that overall cost of your need. Okay, additional services. There are some bundled services that are free to members to use. One is the RX Marketplace. I'm going to talk more about prescriptions in a moment, but this is a resource to find the lowest cost prescriptions, sometimes used by members if they're on a brand name medication or some sort of specialty med, but most meds are handled through your e-benefits Summit plan. So let's talk a little bit about elective surgery. So primarily up to this point, it's been a kind of an emergency situation, like with the broken leg example. There are situations where you may see a doctor and for some sort of ache or pain, and then they're going to recommend you see a specialist, and that specialist may recommend surgery. The key point on elective surgeries with SADERA is get them involved early. So once you've got that referral to a specialist, I would suggest you call and open up your need with them. They're going to walk through a process that includes Second MD, which is a complimentary service, which basically is going to confirm your diagnosis and your treatment plan. They're going to look at the doctor you're thinking of using to see, you know, what their reviews and qualifications look like, and they're basically going to give you a thumbs up or thumbs down. The Second MD is not a binding decision. SADERA just wants you to have the best access to information, and they're going to incentivize you by reducing your IUA to use the Second MD service. They've also launched a shopping service called Savos that launched over the summer. And Savos basically will help you find a physician if you can't locate one or you don't really have one in mind. So they're gonna, it's a process where they assist the member one-on-one to find specialists, look at their ratings, make sure they're not gouging members on cost, that sort of thing. So it's actually two steps to it. You're going to do the Second MD and you might do the Savos. In most cases, SADERA is going to prepay for the elective surgery. So you don't even have to deal with collecting the bills and that sort of thing. They're going to talk to the doctor, negotiate a prepaid cash price for the service, and then you're good to go. So we can kind of skip through this stuff. That's kind of the fluff. Okay, now we can move on to the other side of the program, which is the preventive care and the small to medium costs, which is where you're going to spend most of your time utilizing the benefits in the program. So two options, as you recall, there's the Essential Plan and the Summit Plan through e-benefits. The Essential Plan is basically your low-cost alternative in the program. It has 100% coverage, no copays for the 80 federally mandated preventive care services. It comes bundled with the Recuro Health telehealth service that I'll talk about in a moment. And it also is pairable with a health savings account. The key takeaway here is this is preventive care only. There is no copay framework. If you want to go into your doctor for the flu or something like that, that's going to be out of pocket. This is only the preventive care services. So who enrolls in this? It's usually the person who says, I never get sick. I don't go to see my doctor. I don't want to pay a lot of money. They'll enroll in this. It's often also someone who has a health savings account or has experience with health savings accounts. and loves it. They realize they may go out of pocket for some costs from time to time, but they're going to sock away savings into their health savings account. So here's the slide on that. If you're not familiar with health savings account, they're like flex spending, but it's not a use it or lose it thing. Pre-tax contributions can accumulate in them, and they're actually convertible into an IRA. So some folks that we talk to are already using this for retirement savings. And like I said, if they get the flu and they want to go to their doctor, they know they're going to pay out of pocket on it. But they just love the concept of the HSA. It can fund any qualified medical expenses. And at the bottom of this slide, you can see the contribution limits for 2024. Option 2, 80 to 85% of our enrollments are in Summit. It provides the same 100% coverage for preventive care, the same Recuro telehealth benefit, but it also adds a copay framework to the plan and prescription drug coverage. So the co-payments will cover you in case you want to go into your primary for the flu, like I just mentioned, or if you need to go to a specialist, like Kevin has to go to his rheumatologist over here. It handles brick and mortar urgent care, labs and imaging, MRIs and CAT scans, and prescription drugs, as I mentioned. So this is the more robust program. Most of our enrollments are in this. Here's the copay schedule. So it's a $20 copay visit for primary, $50 for specialists, etc. On the prescription drug side, very strong program with generics. There are over 800 generics that are priced at $1. There's some that are at no dollar copay. One of mine is $0. It's good up to tier 4 with no limits, annual or monthly. Where the program gets jammed up a little bit is in the tier 5 and tier 6 range. Usually these are things that would be associated with a need like, a cancer diagnosis, that sort of thing. But it could also be a psychiatric med or simply a new medication that the doctor's prescribing. The coverage may not be great in those 2 upper tiers. That's where we engage the service at Sedera that I mentioned, their drug buying service. Or we'll direct folks to GoodRx Gold, which we've done in my family. And then also there's the availability in many cases of manufacturer's coupons. So we'll provide a little support there in helping you sort through those options as well. So the Recuro Health app, this is new last year. It's an expansion of the telehealth benefit in the program. There's 3 aspects to this. There's Recuro has a primary care component, an urgent care component, and a behavioral health component. So we're most familiar with urgent care. That's when you're not feeling great. You think you might have something like a sinus infection and you want to get a Z-Pak for it, that sort of thing. That works the same way as you're probably already familiar with. You set up a call or a web call with a physician. They go through your condition with you and write prescriptions. That's pretty standard, no cost, unlimited use. But Recuro also has primary care. So if you're in an area that doesn't have a lot of options, and you want to try having a primary physician relationship, you can do that through Recuro also. And you'll pick a physician. It'll be your physician, just like your regular doctor would be. They'll mail home test bank to you for your basic tests and things for like cholesterol, and you'll self-test that at home. I don't know anybody actually that's done this yet that I've talked to. I've used the urgent care myself a couple of times, including twice traveling, and I was very pleased with it. I got on the phone with somebody within 15 minutes or so. They were able to phone in a prescription to the place I was going to while I was on the road, which was super convenient. So that I do have personal experience with that part of the Recuro app. And then there's also behavioral health, which is sort of on-demand counseling. It's not ongoing psychiatric care, but it's for marriage counseling and things like that, where you basically need to talk to somebody for a few visits, and it's not ongoing or medical in nature. So, if you'll recall, with Sedera, I emphasized that there's no medical network that you have to work within. On the e-benefit side, there is, and it's the MultiPlan PHCS network. MultiPlan was founded by United Healthcare It's a huge network. There's almost 1 million participating physicians nationwide in it. There's a search process that I've got up here on this slide. This was for me. I was searching for primary care for my zip code, about 40 minutes outside Washington, D.C., in a fairly rural area. And there were 475 hits for primary care around my zip code. So just illustrates the breadth of the network. If you've got a doctor you're already using that's not in PHCS, there's a nomination process that we can help you with to get them added in. And worst case, if the doctor you're going to is not in network and you want to continue with them, eBenefits will reimburse at 150% the Medicare rate. So it's not nothing. If you go out of network, it's not like it's 100% out of pocket. You are going to get that 150% of Medicare. All right, so costs. Down the left column, you have individual and their spouse, individual and kids, and then the entire family, spouse and kids. Center column is the pricing for essential, and on the right column is the summit plan. So the red arrow is for Kevin, because we always use him as our example for a pre-existing condition. So he's an individual on the summit plan because he has his specialist visit and his prescription drugs. He pays $172.62 a month for the e-benefits. Now, Sedera pricing is a little more granular. As you'll recall, you have the 5 IUA options: 500, 1,000, 1,500, 2,500, 5,000. The higher IUA you pick, the lower your monthly cost is going to be, just like a deductible would be. This shows the middle 2 tiers, the most popular tiers. It would be impossible to sort of show all 5 levels on a slide like this, but down the left side you'll have individual, spouse, children, and family, just like e-benefits, but then it's banded by age. So you have an under 30 band, 30 to 39, 40 to 49, 50 to 59, et cetera, and 60 plus. Again, the arrow is Kevin. So as an individual enrollment in the 40 to 49 year age band with a $1,500 IUA, he pays $136 a month for Sedera. So his total cost is $308.62 per month. Again, that's eBenefits Summit with specialists and prescription drugs, and a $1,500 IUA Sedera. And that compares favorably to his Blue Cross Blue Shield plan, which he was on, which was $590 roughly. So he was saving a little less than 50%, but close, and certainly a meaningful amount of money. So I'm going to pull up the website here for a second that's linked on the UASA page. And I'll just give you a little familiarization here. So if you click on this SALA HP tab, that's going to get into all the program details. And inside each of these expanding boxes, you're going to find all the program documentation. So rate sheets, kind of the marketing PDF, the schedule of benefits, which shows everything that's included. So essential at the top, summit here. The 3 different components of the Recurro telehealth is here. So you can read about the virtual and primary and urgent care, as well as behavioral. And the PHCS search instructions are listed here. You can also email us and we can run a directory for you if you just give us your zip code. Happy to do that. This box will provide the Sedera information. So there's a video here with an overview. The big one here is the membership guidelines. That's basically how the whole thing works. And I would encourage you to look at that if you've got questions about Sedera. More documentation about Recurro, some of the other services that are available. And then down here is the dental, as I mentioned. So you'll see the pricing is $42.33 a month for member only. And then families $103.53, and it's the Aetna network. So we provide a second search here for providers. So again, this is linked on the UASA site, and you can get all this information there. So let's go back to my slides. Now it is currently available with Sedera in 45 states. If you're in any of these states that Sedera is not currently operating and we have a different cost share solution available to you, just email us and I'll we should set up a phone call and go through it. It operates very much the same as what I've just presented on Sedera, with a couple of small nuances, but happy to give you a full debrief on that. So if you're in Vermont, Washington, New York, Pennsylvania, New Mexico, or Illinois, just shoot me a note. The highlights on the program. So if you're an employer, you can run all your enrollments through your organization. We would just set up what's called a list bill for you, and that provides a dedicated enrollment site and puts everybody on a common invoice each month. And then you would handle any payroll withholdings or contributions on the payroll side. However, you don't have to do that. You can enroll directly or refer employees to enroll directly, and they can get the same savings. They would just set up for the monthly contributions to be taken out of their own personal bank account, not through a company bank account. It is available to full-time, part-time, and seasonal, even 1099 employees. There is no full-time requirement, and there's no minimums. So if you have one person that wants to do it, that's fine. If you have 10, that's great too. There's not going to be any sort of group minimum or anything like that. It provides a great benefit, obviously, allowing everybody to realize 50 to 60% on average reduction for their healthcare costs. And we do have the dental option, as I just mentioned. So the key date too that you should know is the 18th of the month. So there is no open enrollment season with this program. You're free to join at any time. You're free to leave at any time. Just keep the 18th of the month in mind. That's the cutoff for changes processed for the first of the following month. So for example, today's the 16th. We got 2 more days to enroll if you needed a December 1 start date. After the 18th, it would be a January 1 start date. Same thing with cancellations or dependent ads, things like that. So it's a very flexible program. The sweet spot really is for small business, individuals, sole proprietorships, things like that. And if you have any questions at all, I encourage you to email us at that hpsupport@smallassociations.org. That's going to get you into our help center, and somebody will get back to you. We can go through the slide deck again, discuss pre-existing conditions. We can look at the formulary to price out meds for you if you've got prescription medication questions. And overall, just here to help you make a good decision about the program, and if it is a benefit for your family. So with that, Sarah, we can jump into questions.
Perfect. The first one is, does coming to a caregiver, lab, etc., as a self-pay limit who you will see? In other words, do some people have difficulty finding care because people don't accept self-pay?
No, that hasn't been our experience in the program. Like I said, it's you're basically billed for services. So they may ask for insurance when you come in, and you would just say, and again, this is only on the Sedera side. On the e-benefit side, you're going to have a card. You're going to present the card. It works very much like traditional insurance. So this idea of being self-pay only applies to those catastrophic major medical incidents for things like hospitalization, surgery, things like that. So if they ask for insurance information, you say, I'm a self-pay patient. Please invoice me. If they ask for some sort of payment, Sedera recommends you only pay up to the amount of your IUA. They never want you paying the whole amount, because if there is any excessive charging going on, Sedera loses the opportunity to negotiate that with the provider. And the idea of negotiating those bills is really about bringing down the overall cost of healthcare, particularly for the people that participate in Sedera, since everybody's contributing towards each other's healthcare really at the end of the day. So no, there's not going to be any in-network, out-of-network. You're going to be seen and treated and billed for the services. So that hasn't been an issue in our experience.
Perfect. Thank you. The next one is, with Sedera, what is or isn't covered? Is there a sharing limit for catastrophic charges?
No, there's no maximum limit on that at all. And I would direct you to the member guidelines document on the website that I showed you. So it gets into things like, how's a pregnancy handled, for example. And real quickly, that up until birth and delivery, that's handled on the Sedera side. And then as soon as a baby's born, they shift over to the e-benefit side for childhood immunizations and things like that. So there's a special IUA carve out for a childbirth, so it doesn't, it's independent of what your regular IUA is. And in some things like alternative medicine, for example, that can be handled through Sedera. What they don't like you to do is just throw mud against the wall. So try chiropractic for a little while and then go in and see a regular person and try that for a while, like physical therapy, and then, end up in surgery. They want you to make an informed, that's part of the idea of having second MD available to you too. Make a smart, informed decision about the course of care that you want to follow and then see that through. So they do have some restrictions on things like chiropractic, but it doesn't mean you can't go that route. They just have sort of a traditional medicine mindset. And if you and your doctor feel that an alternative approach is really the best way to go, that's probably going to be approved. They just want you to commit to that. And like I said, not throw mud against the wall. So I hope that got to the point of that question.
Okay. If not, David, comment again. The next one is, are maintenance medications for pre-existing conditions covered in the first 3 years?
Yes,
For an
because
example,
there's
Synthroid.
yeah, there's no, if you're on a maintenance medication, it's automatically going to go to the e-benefit side of the program, which does not have pre-existing limitations.
Perfect. Are these programs just for owner operators, or can they be extended to teams? Oh, cancel that question. Sorry. I was going in order. You answered it for me.
I answered it, yeah.
Okay. If an employee is on Medicaid, would participating in this make it so they can't participate in Medicaid?
No, and actually people generally, well, I mean, the rule that follows there is that if there's a traditional insurance policy in place, that will pay first. So if you got Medicaid, for example, and you've gone in for something and something wasn't covered by Medicaid, the balance of those bills could be submitted to Sedera, if that makes sense. And then on the Medicare side, you age out at 64, basically out of the program when you're eligible for Medicare.
Okay. Thanks, Rich. Does anybody else have any questions or want clarification on anything? Oh, if paid through the employee's paycheck, is this pre-tax for the employees?
There's a formula for it. Sedera is not pre-tax because you're basically paying with after-tax dollars. But there's a portion of this that can be set up as pre-tax. And if you want to email me at that HP support email address, I can get you the document that kind of explains that.
Okay. How about employers?
Well, it would be,
yeah,
it's the same rules would apply. With the employers, sometimes we get the question whether or not it's a deductible expense. I mean, it is a business expense if you offer the program and make a contribution towards someone's healthcare.
Okay. So as a tax deduction.
But yeah, it's on the expense side of your business. Yeah.
Perfect. Anybody have anything else? Well, I think you've covered everything, Rich, and answered all the questions.
Well, I hope so. I have to kind of fly through the thing to, get it all in and not occupy a ton of people's time. So if anything, didn't make sense or I kind of skimmed over something, just please email us. And like I said, we're happy to kind of take a personal approach with you and help you size up the program, figure out if it's a good fit or not.
Perfect. And for any of those who weren't able to watch the whole thing or had questions and he answered them at the end, but you didn't quite get it, it is being recorded. So we will put it on our website as well. So thank you everyone for joining us today. Rich, thank you. And we look forward to seeing you soon.
Yep. Thank you, everybody. And appreciate your time today.
Awesome. Thank you.